My name is Melissa Plaza Ponce, and I talk about HCV-associated liver fibrosis and HSD17B13. In definitions, the hepatitis C virus test, HCV, is a blood test that detects genetic material of the virus that causes hepatitis or the proteins that the body produces against it. HCV is transmitted through infected blood, and the HCV antibody test detects antibodies against HCV in the blood, indicating that an HCV infection has occurred. This test cannot distinguish between an acute infection or a long-term infection. Enzyme immunoassay may be the first test you are given to detect anti-HCV antibodies. The expression of HSD17B13 is markedly increased in patients and mice with non-alcoholic fatty liver disease. Hepatic overexpression of HSD17B13 promotes the accumulation of lipids in the liver. In this review, we summarize the recent progress regarding the role of HSD17B13 in the regulation of hepatic lipid homeostasis, and we analyze the genetic, genomic, and proteomic tests that support the pathogenic role of HSD17B13 in NALF. Liver fibrosis results in reduced blood flow through the liver. As healthy liver tissue is lost, the liver also loses its ability to function. Without treatment, liver fibrosis can progress to liver cirrhosis, liver failure, and liver cancer. Unfortunately, many patients with FLD and liver fibrosis do not realize they have liver disease because the symptoms are usually vague, such as mild fatigue or abdominal discomfort. As liver disease progresses over time, patients begin to experience loss of appetite and weight, weakness, sickness, yellowing of the skin and eyes, fluid buildup, and swelling in the legs and abdomen, confusion and difficulty concentrating. In application in medicine, in definition, the video that is
My name is Matt Sweet. I'm at the Institute for Molecular Bioscience, or the IMB, at the University of Queensland in Brisbane, Australia. The study that I'm going to talk about for JCI Insight was focused on chronic liver disease or liver fibrosis. And this study involved a number of researchers, including from the University of Queensland's IMB Centre for Inflammation and Disease Research, the Centre for Liver Disease Research at the University of Queensland, and also clinicians and researchers at the Princess Alexandra Hospital in Brisbane. Chronic liver disease can arise from many different causes, but in general, repeated rounds of injury results in cell death that leads to inflammation, and ultimately this drives an aberrant wound healing response causing fibrosis or scarring of the tissue. And if this occurs over many years in liver disease, this ultimately results in failure of this vital organ. This study focused on really two key questions around chronic liver disease. The first was asking whether there's a core gene signature that's associated with liver fibrosis irrespective of etiology. There are many different possible causes of chronic liver disease, for example excess alcohol intake, poor diet and obesity and other cofactors, and also some viral infections like hepatitis C virus. But despite this, in all cases, fibrosis drives disease progression. And so the key question we wanted to ask was whether there is in fact a core set of genes that are associated with the development of fibrosis irrespective of the underlying cause. We undertook RNA sequencing on liver biopsies from patients with different stages of liver fibrosis, and those patients had different underlying etiologies, for example, fatty liver disease and HCV infection. And so by profiling those patients with different etiologies, we were able to arrive at a core set of genes that were associated with chronic liver disease in different conditions. And from that, we were then able to use a set of biomarkers present in serum from the same patients to correlate that with disease progression as well, which provided independent way of validating our findings. A key finding from that approach was the identification of a transcription factor called ETS homologous factor, or EHF, as a transcription factor that was associated with many fibrosis-associated genes, and in cell-based studies we could further validate the role of this particular transcription factor in driving the expression of fibrosis-associated genes. We also performed meta-analyses with other publicly available data sets to really further validate our data, and for individual findings, for specific genes and proteins, we could then validate those in independent patient cohorts. So the second question focused on fatty liver disease and was trying to understand whether there's a gene signature that's specifically associated with steatosis in advanced disease. And that's because fatty liver disease, which can progress to non-alcoholic steatohepatitis, or NASH, has a huge prevalence globally, and NASH is a major clinical problem, and there are no therapeutic options currently available for this condition. We performed RNA sequencing, again, from HCV patients, but now segregated those into patients that had steatosis and those without steatosis. And by performing this analysis, we were able to identify a small set of 12 genes that were specifically associated with advanced disease only in those patients that had steatosis. And from this analysis, we could identify potential drivers of fatty liver disease progressing to NASH. For example, a particular extracellular protein called FSTL1, which is a member of the SPARC family of proteins, was specifically elevated in advanced disease in patients with steatosis. I'd particularly like to acknowledge the contribution of Divya Ramnath, who was the lead author on this study, for not only driving the majority of work in this project, but also really bringing together collaborations from different groups that are associated with this study. And I'd also like to particularly thank Elizabeth Powell, who's a hepatologist at the Princess Alexandra Hospital, for providing the clinical samples for this analysis, but also ensuring that we were asking the right questions for this study.
In application of medicine, it can also be used in hepatic cirrhosis and hepatitis C, which are liver pathologies.
Hepatitis C is the most common form of viral hepatitis in the United States. The CDC estimates that over 5 million people in the United States have been exposed to hepatitis C. And because once you're exposed, 85% of people will be unable to get rid of the virus, the majority of those patients will still have hepatitis C. Hepatitis C causes no symptoms, and thus many people will have it for many years without being aware of that infection. Hepatitis C is difficult to treat because we haven't had, up to this point, agents that directly affect the virus the way we have for HIV. Thus, our attempts to cure hepatitis C have had to use interferon, an injectable medication that has a lot of side effects, and ribavirin, an oral pill that doesn't work very well on the hepatitis C virus itself. So for many people, a cure was unattainable. But the main reason so many patients with hepatitis C have not been cured is because they have not been diagnosed. It is estimated that 75% of patients with hepatitis C in the United States are unaware of their infection. This is why the CDC now recommends all people born between 1945 and 1965 get tested. We now have newer medications that can cure 80%, possibly more, of patients with chronic hepatitis C. And these medications are getting better, easier to tolerate, with fewer side effects. And so it is important that all people get tested and be treated, because hepatitis C, unlike HIV or hepatitis B, can be cured.
And pros and cons. Pros and cons. In cons, highlight invasive tests. Potential complications include mortality, significant sampling error, high price, interoperation. And pros, golden standard for diagnostics, confirmatory diagnostic value, etiological suggestion, differential diagnosis. Evaluation of the rate and stage, therapeutic decision, treatment evaluation, comparison in the follow-up of patients not treated and treated.
My name is Dr. Dhanashri Kulkarni. I have done my MBBS followed by DCH, that is Diploma in Child Health, after which I have done a fellowship in neonatology from KM Pune. I am working at Cloud9 Hospital Shivaji Nagar since last 2 years. Hepatitis B vaccination, it is advocated to be given as soon as after birth of the baby, and this definitely should be completed before discharge. So a delay more than that, generally it is not advisable. Pros are many, that is, it helps to prevent this dangerous disease known as hepatitis B infection. The infection with hepatitis B spreads through infected needles, use of blood products which have not been screened well, sharing of needles, drug abuse, or sexually transmitted in the older population. So this is a very dangerous disease. The primary infection may be just like any other jaundice, but the important thing we need to know is that there can be a chronic infection which affects the liver very badly, and in turn the person can develop a cirrhosis of liver, that is a chronic condition of the liver, and also it is at risk of causing a liver carcinoma, that is cancer. So 100% we need to prevent this disease, and as early as possible this vaccination should be given after birth. This has also been endorsed by the American Academy of Pediatrics, and this is the guideline which we are following. At Cloud9 we give the babies hepatitis B vaccination immediately after birth. The vaccination is placed at the resuscitation trolley itself. So once the baby is stabilized, we immediately administer the vaccine. And if you ask me the cons, hardly anything, something related to the pricking of the needle, that is little pain, irritability. Very rarely there can be a fever. But these cons are so little and they are so negligible that I am of the opinion that all of these babies should be given the hepatitis B vaccine.
Statistics in Ecuador. In Ecuador, in a graded percentage, approximately 65% prefer to use HCV because of the excellent results it provides when helping us in the diagnostics, especially in liver disease. And in conclusion, we can say that HCV is an excellent method of diagnostics, especially in hepatitis cirrhosis and hepatitis fibrosis, and that HSD17B13 is a very good inhibitor when helping with the treatment of this liver disease.